I will apply simple facial lifting for her, and I also applied leg lifting to her. I would like to show how to design here. First, we should point the tip of jowl here, both sides of tip of jowl, and then I make a line to the medial canthus along a nasolabial port. Usually 1 cm laterally, this way, parallel to nasolabial line. The other side parallel with the nasolabial port to the medial canthus. But usually you should put the middle tip near around here, not till the near medial canthus. Okay, and then we can make another line from the tip of jowl to laterally, and we make another line from the base of ear or the anterior point of tragus to chin. It seems that many people think that price lifting should be done superiorly and laterally, but some factors should be done on medially, because when a person stands up, you may feel something drooping through this vector. So if I correct this vector, I can make the nasolabial port improved. So, and then after inserting the thread on face, I will inserting some thread from the mastoid to the medial neck along the mandibular margin, about 3 to 5. And I also apply cocking screw with the mesh method here, and I apply monogrip as it did parallelly to the RST here. Okay. No. Okay. Yeah.
Before and then.
Put the glove. Okay. Okay. First of all, I will block. No. I will inject on the point of insertion. It's very painful. So you better to shake your hands. And I usually apply the mental love. Can I get some more lidocaine? What? Lidocaine. Okay. It's not here. And I also block the infraorbital nerve. One more lidocaine. Lidocaine, please. Do not. Okay. Sure. Okay. So now I want to show to find out R point. So this is the lateral borderline of SCM. You may also see the jugular vein here. So this is the R point. If we block this point, you can cover almost all the neck, but sometimes it's difficult to block it. So you'd better inject the lidocaine solution around here sufficiently. Okay, more. So fine again. Here's the lateral port of SCM muscle, and this is the jugular vein. I can block here, and it's very painful. Okay, and then this one. Excuse me. It's a tumescent solution, which means it's a diluted lidocaine. Usually I add 20 cc of lidocaine and 10 cc of bicarbonate with 1 cc of epinephrine to 6 cc of lemosaline. So, little. Okay, I'll see.
Yeah. This is very big.
Okay, open. Okay, this is 27 gauge cannula. I usually use this to inserting the tumescent solution. So I make her with a needle, and then I can inject the tumescent solution along the pathway of the thread because the cannula is too thin, it's too pliable. Okay, other side, needle. Making a hole and then insert the cannula. Can I have one more cannula? Through the pathway of the thread. Okay, I'd like to use a needle. Okay, press the other side. You do better to inject the tumescent solution around here because there's a foam tissue which is very difficult to make a pathway through. So I usually inject this area with the tumescent or the dental kinds. Okay. Can I get some more tumescent solution? Mm-hmm. You need it. Mm-hmm. Yes, you want. Tumescent solution. Okay, so this area is very difficult to go through, so that's why I inject sufficient tumescent solution on here. Okay, so I think needle the 18 gauge needle. Can I have that? 18 gauge needle. 18 gauge needle. So I'm ready to start. So the next step is very simple. I will make a hole, as I said, on tip of towel. And then in this time I will use cork master gear. First, medially. Clean the tissue tightly and apply the needle and remove it. Then, okay, I will apply the second one to the lateral canthus. You have to pull in the tissue, but there is some retaining ligament around the zygomatic arch. So it's difficult to embed that area this way, and then okay. So I apply the 3-thread master gear here, and then like this. And mild rubbing is required to correct the dimpling there. And then I also apply some more thread from the base of ear to the chin. Can I have one more? Okay. When you feel difficulty to insert the needle, just twist it. Okay? Mm-hmm. Okay. So I apply the 4 thread on this side. So as I said, I fixed I'm pulling with the hands and fix with the thread this way. So this is a very simple procedure. But deep press, okay? Yes. Mm-hmm. So head up, please. So, not so prominent, but it works, I think. Okay, head up, please.
Over.
head up만 하세요. 네. head up. Is it better? Uh-huh. You may feel the difference. So I only use 4 thread on one side, so we can make this difference. So if you think it's not sufficient, you can add more. Especially, so with better to correct the ptosis of lateral side first, the medial side first, because to control the nasolabial fold. So it's okay. Can I apply it to the other side? Okay. Yes. Well, actually, for fast procedure, if I insert only 8 thread, I only inject the dental lidocaine. It's enough. But if I add some more, if I add some more caulking screw plus like that way, so I should block the infraorbital area, and I also inject some more tumescent to relieve the pain. Okay, and then I applied this maneuver on the other side. Okay, with the maker on tip of jaw. So it was not Cogmaster gear. It was Cog Pro 2, Cog Pro 3, but it works. Cog Pro 2.0, but it works. I think that most of you don't have the experience using Cog thread, so you don't want to use the thick thread because you cannot expect the result. It's okay, as I said, yes. Without pier, you can apply it. Pulling and inserting the thread. If we want to remove the thread, because you make some dimpling during the insertion, so don't forget this. Just grab the thread and needle, then remove that. If you forget thread, it will remain into the skin, okay? When you meet the retaining ligament, so twist the thread, then you can easily insert it. In this condition, do not put tightly, just mildly, it's enough. And then, okay. No? Okay. Mild rubbing to correct the dimpling around here. So after that, I usually apply some more caulking screw around malar area, medially and superiorly to augment this. When people is augmented in this area, they'll look younger. Okay, but I will show you in next case. Okay, I completed the simple facelifting. As I said, it will be a good procedure for beginner, but you are used to this procedure, you can try more. Like you can inserting almost 30 thread on the face. I will show you next time. Okay, and then I will apply. Okay. 고구마 스틱이네. 근데 뭐 괜찮을 것 같아. 색으로 주세요. 리로드 돼. Okay, I applied another thread from the mastoid to medial neck. We should start on mastoid because I will show you some interesting procedure. This way. And then, so I'll show you something different. middle holder. Okay. So this is, can you see this? This is pre-curved needle. So to fix the residual tip of the thread on mastoid thread, mastoid periosteum. Okay, I'll do this. Here. And okay, so I fixed the residual end. So with this maneuver, you can support more strength with this thread. Okay, then I will cut the remaining tip. Do not bend so much. And then I will apply more thread in this way. So I will not fix them because of the time. Yes, okay. So you can fix every thread on the periosteum, but we don't have time now, so I will remove it. Slotting. Okay. And then we apply on this side. 적어주세요. 참. Can I get the thicker one? Okay. Insert the thread along the mandibular margin in fin shape. I will show how to fixate again. Where's the needle? Curved needle. No, curved needle. Curved needle. Where's that? So we cannot find out the curved needle, so I will show you some different method. Okay, here. Because we don't have pre-needle, I will use something different method with the front needle here. Set. So scissor. Scissor. Okay. Okay. And then apply more mustard here. So I will add 3 more threads to make the symmetry. To mustard here, more mustard here.
More.
이전에 코어 mustard here.
Can you give me?
코어 mustard here 2개 주세요. If you fix more thread on mastoid periosteum, it will pull the tissue more tightly. But as I said, we don't have enough time. That's why I fixed only 1 thread here. Two, 3, it's enough. Enough.
Enough?
Yes. Okay. Scissors. Yes, we cracked the shape. I'd like to compare both of the sides, but it's really difficult. We should move the camera. And then, so we developed this area better. We should apply caulking screw around here with mesh technique. Caulking screw. So can you see this? That there's a spiral from cork thread. Is this not cork thread? Spiral one? Okay. And this way, we should make a mesh here.
No.
이것도 주세요. One more, okay. So it's loaded on sharp needle. It can make bleeding, so you should prepare to remove the needle. It's okay. It's okay. So press this area only for a few minutes. And mono it. It seems that there's no severe bleeding here, so we should pull the thread a little bit and then remove them one by one. So, do you observe this? The sagging here, I made a depression around here. The sagging was improved. Okay? And then I usually apply corkscrew parallel to the RSTL, but in this case we don't prefer the corkscrew. I will apply the monogrid this way, parallel to the RSTL. So with better inserted in subdermis. And then to induce more mechanotransduction, we'd better to twist the needle at least 4 rounds. More than 5 rounds, it's okay. But it should be done one by one, but it takes time. I usually let the nurse do this. And then I apply them simultaneously. If there's bleeding, it's okay. Just press it for a few minutes. Are you okay? Mm-hmm. Mm-hmm. Okay. I will insert on the other side, parallel to RSTR. I usually insert more than 20 cogging screw here, but if I use mono thread, I should insert more, around 40. Okay. Whenever you should remove the thread, you should clasp the needle and the thread simultaneously, and then remove it. Okay? Okay? It's okay. Sorry? I cannot hear you. Yes. Okay. It's cogging screw, but I usually apply cogging screw, but we don't prefer it. I use the mono grip. I'll explain this first. So if do you remember cogging screw? There is a cog on a spiral thread outside, but there's a straight thread inside of the needle. It's a cogging screw. So I usually apply the cogging screw on neck because I can reduce the number to correct the wrinkling there. But in this case, we didn't prepare the cogging screw, so I applied the mono grip, the mono thread. Okay? Yes. So for cogging screw, you don't have to twist it.
I do.
Sure.
Yes, everything.
You already did that? Okay. Okay. So it's done. Do you have any question about this procedure? Okay. And then I usually use this white pencil, which is very useful because it's not easily removed. But if I intend to remove it, it will is removed easily. So it's a really good material. So you do better push your distributor to give it to you. Okay. So can I observe the result? So we cannot compare the result, but we just observe it. Yes, we can. Yes. The effect of local anesthesia goes on for 3 to 4 hours. So you may feel some improvement through the nasolabial fold, and then we improved the jugular, the jowl, and the low border of pace. You may feel the difference. Okay, and then the neck contour was developed a lot. Did you take a picture for her before the procedure?
Yes, we can.
Yes? Far better. So, how about the pain? It's okay?
Okay.
Yes. So you better apply some patches on inserting side. That's all. And apply some ice pack for a few days. Okay?